Hello everyone, welcome back to our Healthcare Engineering YouTube channel. This is Gaston, admin of the team. This is the final and the fourth part of Engineer Shamila Ariaratnam's interview session. In this interview session, she is going to provide her valuable ideas for the students and newbies who are going to join in the healthcare industry. After that, she talks about the current job market in the healthcare industry and how it is going to change in future. Finally, she covers up what are the skills and requirements that the students and newbies need to be equipped in order to recruit well in the healthcare industry. Once you follow her advices, definitely you can be recruited in the healthcare industry and the interviews you face. We would like to request our viewers to share and subscribe our YouTube channel with your healthcare contacts and provide your likes and valuable comments. It will be a huge encouragement to our healthcare engineering team. Definitely we will bring several other knowledge sharing sessions like this in future. Please stay tuned with us and support our YouTube channel. Thank you.
And other universities, they can offer courses that can also be relevant to biomedical engineering. So all these universities, you would probably have, a minimum of 100 students graduating, right? But, even in a hospital, just how many engineers are employed or how many vacancies actually appear, right? So there is actually a gap there that needs to be addressed. So even if they were to join the manufacturing facility or the distributor or the authorized representative, just how many vacancies are there as opposed to the number of graduates that are being churned out each year. So this is something that we need to consider. No doubt, there has been projections saying that, in this year, we need this many engineers. But at the present moment, based on the trend of employers and the amount of employees that they are employing, it doesn't seem to commensurate. So that's a gap that we need to address.
Okay. Okay. Okay, ma'am. Thank you so much. Okay, so let's move on to the next point, ma'am. Since you play several roles in the healthcare sector, what are your advices, ma'am, for the students or the freshers who are supposed to enter the healthcare sector as a freshers? So what kind of advices or wishes you can give to such people?
For a first job, okay, because in many countries, Malaysia is also the same, a lot of employers look for experience as opposed to qualification. Okay. So for the first job, I would encourage, students to, have an open mind, accept whatever job they get. Build in your next job, you can probably, set some terms yourself. But generally, people find it difficult just to even get the first job. So I would suggest for the first job to be a little open-minded, right? If they do get their dream job at the first attempt, all is well and good for them. Otherwise,
They must be
to
really
have
lucky.
an open mind.
Okay.
Yeah, because even I myself, my first job, to honestly tell you the truth, I attended many interviews. And finally I landed a job in Tri-Systems Engineering. And I went through interviews. First is with the HR and operations person, and the second was with the managing director. I was very happy when the managing director said, all I want is someone who's willing to learn.
Mm.
I was very happy when he said that. No matter how much we have learned in university,
Mm.
it is just a stepping stone, in the real world.
Mm.
When we actually
Mhm.
go out and start working, there is
Mm.
it's a whole different ball game. Uh, it it's very different. So
Yeah,
sometimes
even I
education
feel the
alone,
same way. Yeah,
yeah.
because
So the
when we see in
education
the
is
industry, it's totally different from the academic side, right? Isn't it?
correct. We are actually sheltered from a lot of things. We're
Mm.
protected from a lot of things. We don't see a lot of things, but actually when we start
Mhm.
working, it's very different. And
Mhm.
sometimes you gain this experience by working. So
Mhm.
for me, I would ask fresh graduates to have an open mind. And
Mm.
besides that, when they are studying, they can
Mm.
equip themselves with as many skills as they can. You know,
Mhm.
if they can take up courses on MATLAB, or if they can take up courses on Python, or anything that is of interest to them, apart from what's being taught in the university, then they should
Mm.
also go ahead and do that. And they can also keep themselves, abreast with the technological evolution in the industry that they want to join. So, for
Mhm.
example, if they want to join healthcare and they're particularly interested in oncology, yeah, so they should keep
Mm.
themselves, updated with matters related to that. Yeah. So,
Okay. Okay.
because, like I mentioned, it's very different, and it's sometimes when we go for an interview, the interviewee has a different mindset, and sometimes their questions are very different from what we've actually learned. And
Mm.
sometimes it's what we have learned is just probably 5% of their interview questions. So it's a lot of
Mhm.
other things that make up the employee that they want to employ, whether they are a good fit, whether they can work in a team, whether they are willing to
Mhm.
work hard, whether they are willing to stay back after office hours to get things done. So they look
Mhm.
at all this, the charisma, the proactiveness. So all this, takes precedence over good qualification. Yeah. So that's why
Mhm.
generally employers, they're more inclined to look for employees who have some experience, because
Mhm.
people who have some experience know what working life is like, and
Mm.
they probably know how to also balance work and life. They probably know
Mm.
it's going to be like this, so they would already know how to balance it.
Mm.
Yeah, so if it's a fresh graduate, it's a little bit more challenging. There are organizations who do take fresh graduates. I'm not saying they don't, they do,
Mm.
but generally the market is such that with a little bit of experience, you're a little bit more marketable.
Mm.
So fresh graduates need to understand that the working world is different from the academic world.
Mhm. Okay. Okay. Thank you so much, ma'am, for the advices you gave for our students and the freshers. Ma'am, could you share about your opinion on the industry, about the current industry, and maybe you can share about your ideas on how the future industry will look like?
Okay, the current industry is still, I would say, it's manpower based. Yeah.
Mm.
So to a certain extent, you would need human intervention to get things done. But moving forward with the Industrial Revolution, you would
Mhm.
probably see uh, more processes computerized, more interaction with a robot, yeah, conducting
Mhm.
surgeries with robotic arms. There's positive and negative to it, right?
Mm.
Um, of course, you know, people have to be more equipped in terms of using all these tools, and keeping themselves to learn these things fast. So one of the ways I would look at it is to use mentoring. Try to learn as much as you can from the seniors at your place of work. Yeah, just to shorten the learning process. And also to make sure that you are not extinct, because the industrial revolution is already here. It's already going to take to the next phase. And,
Okay.
we also want to be relevant during that time. So we need to, learn things that will keep us relevant at that time. So all these machines, they use codes, yeah. So we need to look at things that, okay, are we going to go into the coding, or are we going to go into the user interface? Yeah, how do we interface between the machine and the app, right? So we have to see where we can fit in, right? So that we are still relevant in the future. So I see the future of the healthcare industry to be more inclined to the use of software and app and technology which requires less intervention of the human. So when these happen, we have to find where as humans we fit in. And we have to equip ourselves with the knowledge and skills needed to penetrate those areas.
Okay, that's your opinions. Thank you so much. So soon we are going to end this session with two more questions. So you are so senior in this healthcare sector, ma'am. So let's say a fresher or a new student from the university is supposed to enter in the healthcare industry, and you are in the panel. So what are the questions or what are the skills you expect from the fresher?
Basically, I will look at their resume to see whether they have contributed in other organizations. It can be at university level or school level. I would see how actively they have participated, what was their contribution. I would also look at their final year project, what was the topic about, and I would probably ask a few questions just to gauge how much of it they still remember. I will also check on their industrial training, what they have learned in their industrial training, because sometimes they forget, and it's difficult for us to employ them if they've already forgotten these basic things, because industrial training is the one that brings you closest to the working world. So whatever
Yes, yes.
knowledge and skills that they've gained at that time is something that they need to remember. So I would also look at, their time spent on industrial training, what they've actually done. And I would ask questions like, if they were put in a difficult situation, how would they, handle it? If they get scolded by the end user, how would they handle it? If they have to come and work on Saturdays, are they okay with that? So generally, where I worked, we work 5.5 days. So it's Monday to Friday, 8 to 5, and then Saturday is 8 to 12. So initially, it wasn't an issue getting employees to work on Saturdays half day. But as the years passed by, a lot felt that, Saturday and Sunday is the day that they want to be at home, right? So we also had to work around that. So basically, the hospital wants the support because the clinical staff are still around Saturday, right? So, and we also still see our patients Saturday. So that's also one of the reasons why we want the biomedical engineers to also be around on Saturdays, at least for a half a day. So these are some of the challenges that we find. So I would look for somebody who's a team player, who's proactive, who's willing to, learn on their own, and who
Yes.
can take constructive criticism positively for the betterment.
Mhm.
And, they are also there to help others. Yeah. So these are the basic things that I would probably look at.
Mhm. Thank you so much, ma'am, because these kind of things, since you have shared these kind of ideas, what you are looking for, so the students can develop their skills in such areas, so easily they can get recruited, right? Okay, ma'am. So the final and the last question from us. What do you think about our platform and any suggestions on us? Whether we have to correct it or we are doing well or we are doing a poor thing. So what's your suggestion on us, please?
Um, well, to me, because I would say a generation in between.
Mm,
So you can't say I'm totally conventional. At the same time, you can't say I'm very savvy either with all these new, developments out there. Um,
mhm,
for me, the initiative taken by healthcare engineering is unique. It's
mhm,
unique, and I, just like anything else, you're gonna face your own challenges.
yes,
But what is
definitely.
important is to always fall back on your objective of why you have actually started it, right? So
Mhm,
whenever you're down, because anything in any job that you have, or in any endeavor we get ourselves into, there's definitely going to be setback. So
mhm,
when that happens, we need to align ourselves back to our objective. As in, why did we, do this, or why did we start this in the first place? And when you do that, you realize that, you're on the right track. So I
mhm,
see a lot of, information on technologies being shared. I also noticed that you've actually gone out and given talks to students. Yeah, these
mm,
are some of the things that I'm aware of. I'm sure healthcare engineering is probably doing other things as well. So
mm,
just keep yourself close to the industry.
mm,
um, Try to network with as many people as possible in the industry. And
mm,
since we are in a era of globalization, so with all these facilities, like I'm in Malaysia, you're in Sri Lanka, we can do this session. So with all these facilities, right, we you can actually take your platform to a greater level.
mhm,
So I suggest collaboration, like what you're doing now with
mm,
other countries and engineers, or even not necessarily engineers, uh, with other healthcare professionals, even
mm,
the nurses, who the doctors, who the medical lab technologists, yeah, or even
mhm,
people from the facilities, yeah, those who are maintaining the buildings, the fixing, the fixtures. Because I always believe that in order for us to be effective, we need to know what's happening in the hospital. We need to know all around, and not just confine ourselves to our department and the equipment. So if we want to be effective, we really need to know the operations of the whole hospital. So just don't confine yourself to engineering. You can bring in other, uh, I would say, you know, I would say in this case, other professionals in the
disciplines.
healthcare,
Yeah.
yeah, that can
Okay.
also enhance the skills of a biomedical engineer. So, you
Mhm,
would also want to know what's happening in the background, so you can also
mm,
better perform or provide better services. So that's my
mhm.
advice to healthcare
Okay,
engineers.
thank you so much, ma'am. Thank you so much. So, in order to conclude, the aim of our healthcare engineering platform is finding the gaps and the problems in the healthcare sector and filling such problems or the gaps using the engineering concepts and the modern healthcare concepts That's why we started our healthcare engineering platform. So luckily we are doing the webinars and even we are supporting some kind of final year projects in some people in African region. So we hope that it will go properly. So as long as we can, we will provide our support as much as we can. Okay. Thank you so much, ma'am. So let's finish this wonderful, informative interview session. Thank you so much for your time. And again, I have to say sorry because we had some technical issues at the starting point. Sorry for that. Sorry for the inconvenience caused to you as well as to our viewers. And a huge thank you at last for you for having some time for us. Thank you so much, ma'am. And thank you for all the skills you
Okay.
have shared
Thank
with
you very
us.
much again. Yes, I'd like to thank again. I thank yourself, Gaston, and also your
You're
team,
welcome,
the
ma'am.
healthcare engineering team. And not forgetting again, Deepavali is around the corner. So I'd like to wish all those
Yeah.
celebrating Deepavali a very happy and humble Deepavali amid the pandemic.
Yes, correct.
Stay safe. Thank you.
Okay, okay. Along with you, we wish all our viewers a happy Diwali. Celebrate it with your safety precautions. Okay, thank you so
Thank.
much. Thank you so much, ma'am. Let's end this session.
Okay.
Okay,
See
have a
you.
nice
Bye.
day. Bye bye. See you, ma'am. Bye.